So where do you guys see healthcare going in the next 5 years or so?
Especially with data, right? What you just said. I think some of the trends that are already there, they are great trends, and you're going to see them more and more. Like, our neighborhood urgent care centers, because it makes it easy for commuters to get to, but it's also not a stressful environment. It's a decentralized unit, so you're not getting to a hospital and all. So that definitely will stay. The trends that are making it more look hospitality, bringing in the hospitality aspect of it, making them warm and welcoming are going to stay. I think manufacturers are going to push the limits on making things voice activated or touchless, for us, especially with post-COVID, to get us into that sanitation environment that we all not just desire, but demand at this point. So we'll see that. What I think is going to be different, though, like the audio-visual is going to be important, right? The data is going to be important because, like a lot of remote check-ins and remote sessions, you need to have those audiovisual needs brought in earlier now, because they might need a room with TV and cameras and good speaker settings so they can talk to their patients remotely. And that's happening already. What I think is also going to add up now is AI coming into it.
We were talking about that a little bit before we started.
Or just small things like our wearables. We're going to start getting notifications, data sent directly to our providers. They can probably enhance our care based on that. They can monitor us remotely, heart patients or whatever else. They can get their ECGs done on their phone, but the doctors can view it real time if needed, nurses, whatever. But they can also provide a good feedback quickly enough with remote sessions. You don't have to go in person. Another thing would be like augmented reality, like going into a space and finding digital senses. My phone tells me where to, or my watch taps me where to turn or where to go, or I get the next, hey, you are next in line, little pop up on my phone. I think those things technology-wise will be incorporated a lot, and that will kind of make it, we still have to keep the human aspect to it, right? Because that's one thing I fear, that, we got to still have people that can greet you and there's somebody for you to answer, especially in the older age population where, they need that. They can't rely. But as the younger population and as we are now getting more and more into the primary healthcare scenarios, I think that will be super important. The other aspect, I think, is we all think holistically. Medicine is holistically now, right? So it's not just going and seeking a diagnosis and getting your medication or prescription for that, but what do I need to do to live a healthy lifestyle? So we see that already with our providers giving us those multi-purpose rooms and a yoga class or some spin class or something integrated to keep us active and healthy. We had a practice that I actually enjoyed working with them. I didn't see that model carried on more, but I think it should, is adding nutrition into the design aspect, the kitchens, and teaching you how to eat healthy. They'll give you a paper, eat this, but I don't know, I don't know how to make it tasty or what I'm supposed to do. I'm not going to sit there measuring everything. Right. So having those nutritional classes inbuilt, having facilities that have multimodal disciplines and specialties in one space would be helpful. Having spaces like a childcare in there, like a small play area for kids while you go see a doctor visit, keeping your kid there might be helpful. Get in the same place, getting your groceries and running those errands at the same time. I also, just lost my train of thought over there was something else I was thinking.
From a design challenge, we do see, like you just mentioned, that facility that expanded to 13,000 square feet, this multidisciplinary environment to try to maximize people's interaction and try to accomplish many things at the same time. But what's happening with that is some healthcare providers are going into large, big box retail spaces that are not your typical inline storefront. So the challenge there is when you go into a big box and you chop it into 100 smaller rooms and you only have 5 windows in the whole space that are facing the front, how to break down the space in a way that's efficient for the provider, but that is practical for the user, and where you're just not aware that you may be
in a warehouse.
In this warehouse. So that's a fun design challenge, and we keep finding ways to again spaces get judged very face value, what you first see and that first impression, but ultimately how they function and the ease of getting from point A, B, C and navigating through the facility to be able to enhance that experience is what will be remembered further on.
Yeah. It's almost, with the onset of technology and not onset, the increase in technology, right? Everything's getting smaller and smaller and smaller. So the space needed is getting smaller and smaller and smaller. But I think, you guys touch on a good point. I think it's important that as that technology takes more of a role in the healthcare, that we keep the human aspect and we equally as much push the hospitality aspect,
Absolutely.
right? To keep that human aspect. And I think that's what we see, to your point, the onset, a lot more of the centralized healthcare, right? Not your 500,000 square foot tower, but your 20,000 square foot neighborhood.
Yes.
It's like that gym
Ambulatory
mentality.
care.
Like you got to have a gym within 3 to 5 miles of where people work and live, and have that be the go-to for these
That
types
area.
of facilities. Yeah.
I also see a lot of behavioral and healthcare is going to be incorporated in our private providers' offices as well. That is gaining the attention that it needed. So I think that would be a component these days, where we might just have consultation rooms. We do those in on oncology centers and all, where you're trying to, where they're having to have consultations. But I think that will be seen in your primary care providers as well, rather than having your exam table and computer table setting. We should have a few rooms that provide that soft seating and provide the service there.
Yeah, no, I think that would be great.